Well, with the changing seasons come changing COVID shots.
Public Health in Dane County is urging you to get the latest COVID booster if you haven't already.
Both the updated Pfizer and Moderna boosters are available to anyone who received an initial vaccination or booster shot at least 2 months ago. UW Health Chief Quality Officer Dr. Jeff Pothof is back with us.
Hi,
Welcome.
Dr. Pothof.
Good to be here, guys.
So, who should get this shot?
So in a nutshell, if you're age 12 and older, and it's been 2 months since your latest shot, your booster, or 2 months since your last infection, you would qualify for one of these new bivalent boosters.
What does bivalent mean?
So bivalent means it's kind of a 2-for-1. So there's two components to it. The first component is what we're used to. It's the old COVID vaccine. We know that that provides great protection against severe disease. The second component is specific coverage against BA4 and BA5, which are the two most common Omicron variants that are in the community right now. So it's kind of a win-win in that regard.
And what if you've recently had COVID?
If you've recently had COVID, there's a good chance that you have immunity that will last you at least 2 months, maybe 3. So you don't need to rush out and get it if you're recently recovering from COVID. But once you get to that 2 or 3 month mark, getting this bivalent booster could reduce your risk of reinfection.
Is there any benefit to waiting till we get closer to the holidays when you're going to be gathering with family and traveling?
Yeah, so some people are thinking this. So I think, one, if you're older, age 60 or older, and you're due for a booster, I wouldn't wait, because those boosters we know actually have a benefit in keeping you out of the hospital, which is great. If you're younger than that, you could wait. So it's kind of a game of Russian roulette. If you wait and you get your vaccine closer to the holidays, you would likely have a higher antibody titer when you get to the holidays. These shots give best protection 2 to 3 months after you get them. But if you wait and come in contact with COVID right now, you won't get that protection. So for most people, I say just get it now. There's a good chance that you'll still have really good coverage for the holidays, rather than get COVID and then wish you would have got it now, thinking you could wait until the holidays.
Can you switch brands? Does it make a difference? Is it beneficial to switch?
So you can switch brands, and there are some studies. This isn't overwhelming evidence, but there's some small studies that suggest that if you switch brands, you may get increased durability, or that protection that you get from the booster may last longer than if you stuck with the same brand. So I certainly wouldn't tell anyone to not get vaccinated because they can't find the shot that they want. But if both brands are widely available and you've always gotten Pfizer, not a bad idea to consider Moderna, and vice versa. If you've been getting Moderna, maybe get Pfizer this time.
Interesting.
And we've mentioned that you can get your flu shot at the same time. One thing that's been interesting, I was reading that Australia is having its worst flu outbreak in 5 years. And the southern hemisphere is usually a harbinger of what's heading for us. So is that a warning for our upcoming flu season?
Yeah, that's absolutely right. This is one thing that we're actually worried about as healthcare professionals, is we haven't had much of a flu season for the last 2 years. We look to Australia to say, hey, is it going to be a good flu season or a bad flu season? And it's looking like it might be a bad flu season. So as much as we talk about COVID and getting those boosters, it's also really important this year that we all go out and get that flu shot, because it doesn't look like we're going to be spared a mild flu season like we were the last 2 years.
Well, all the protections we were taking for COVID were also preventing the flu.
Yeah, absolutely.
And the masks.
Yeah, for
Everybody
sure.
was wearing masks.
For sure, it works for both.
Can you get both at the same time?
You can, so I've seen that. That's not a fun place to be, as you can imagine, but you absolutely can get flu and COVID at the same time. So
get it over with.
Yeah, there's no free lunch with getting one. You can still get the other.
Separate arms.
Separate arms, I think, is the best way to go. That way your arms are equally sore the next morning.
Now, you just got the new booster. How do you feel? Did you have
I got the booster yesterday around this time, and I feel good. No symptoms at all right now. So some people will get mild symptoms, headaches, fatigue, maybe some muscle aches. But for me, it's been great.
And you switched manufacturers?
I did. I switched from Pfizer to Moderna.
I think I'm going to switch to Pfizer.
That's a good endorsement. There you go.
Jeff, good to see you again.
Thank you, Dr. Pothof. Good to see you.
See you next week.